Today on the Optimal Health Podcast, we have two of the most knowledgeable guys in the world talking all about testosterone replacement therapy. Now, the first one is Dave Lee, who is a world-leading TRT expert, establishing a global following with close to a decade of industry experience coaching clients and troubleshooting men's hormone replacement therapy protocols. Dave has authored 3 books on TRT and has coached thousands of men and is a trusted resource to many of the world's leading doctors and practitioners, and has established clinics utilizing his oversight and clinical practice in over a dozen countries. Dave has recorded hundreds of videos amassing millions of YouTube views, including in-depth lectures and masterclasses, which have provided patients with education and knowledge to optimize and refine all aspects of their health and hormone replacement therapy. The second guy is Dr. Max Draper, a lead clinician at Alphagenics, a private men's health company which is based here in the UK, and he also works as lead clinician at Atlas, which is a testing and diagnostic service. He is a qualified doctor with nearly 20 years experience in healthcare, and he actually spent 8 years as an NHS GP. Following his own challenges with low testosterone, he decided that he would dedicate himself to advancing his knowledge in TRT and more broadly men's health optimization. He actually left the NHS to pursue this fully several years back. This is an absolutely amazing episode, and I'm so pumped to have both of these guys here talking together. They both know each other, they both have a history together, but having the leading guys talking about testosterone replacement therapy, if you know me, you know my story, and you know that I am here to help guys optimize their testosterone to do every single thing they can to not have to need TRT. And if they do then need TRT, they can get pushed to the most comprehensive resources and the most knowledgeable guys around. Seriously, enjoy this show. Hey guys, welcome to another episode. I'm excited for this one. Now, we've got Dave Lee and we've got Dr. Max Draper here. Guys, thank you for joining me and taking the time.
Pleasure to be here. Thank you.
I think it's apt that we talk about men's health. We just had Men's Health Month, and I don't think there was as much talk about Men's Health Month as there should have been, but suicide rates seem to be on the up. I found the percentage for male suicides in 2023 in the UK was 74% of all suicides were male. Do we feel this is a testosterone thing going on, or it's adding to it?
Dave, start with that. You talk a lot about mental side of it, don't you, Dave? It's a lot of your area there.
Let's dive straight in there.
Yeah, straight in. Let's just go straight into the
yeah.
suicide point.
We'll ask about histories in a minute, but yeah.
Yeah, for sure. No, it is an important point. My background was originally in biomedical science. I was intending to complete a master's in neuropsychiatry. I wanted to learn about why so many people were dealing with low-grade mental health problems. I was much more interested in understanding the etiology and the neuropsychiatry of, I guess, what I would call minor depressive disorder, things like this, that I wanted to understand why the world has never been objectively a better place to live, but mental health had never been worse. There were so many people who just kind of didn't want to get out of bed and go to work. And this ultimately led me away from psychiatry and into endocrinology, because when you understand the way that the body works, you realize that hormones are kind of like the marionettes. They're kind of like the master puppet strings of virtually every system in the body, including the way that the brain produces neurotransmitters, which ultimately impacts how we live and how we feel and how we respond to things. So when it comes to men's mental health, I think that there are a lot of biological, a lot of social, and a lot of behavioral problems that are all kind of amalgamating into this mess that we're seeing. And the main message that I try to teach men is to understand the playing field that we're all playing on, because ultimately you have to play the ball where it lands. If you're playing baseball and it lands in a big, fresh, steaming pile of dog shit, you still have to pick it up and play that ball. But also helping guys really understand to be like, how can I take agency over the situation I'm in terms of, one, taking responsibility, but then two, what do we actually do about it? If someone's like, okay, I want to take responsibility, I want to get myself out of the hole, I want to get to a better place, how do I actually do that? And I think a lot of the messaging around male hypogonadism, which is kind of what brought Max and I together, is raising the awareness that there are a lot of younger men, and when I say younger men, I basically mean anyone who's older than me, because I'm perpetually young, at 32. So we often thought of hypogonadism as just something that happens to older men, but we're seeing so many younger men with completely disrupted hormone profiles, both from self-inflicted behaviors, but also in guys who are doing everything right. And I think there are so many men who are going to counselors' offices, psychologists, psychiatrists, GPs, getting prescribed all kinds of medications or psychological interventions when in fact they're dealing with an endocrine issue. So I think testosterone is a foundational problem that the rest of this mess of shit builds upon.
Yeah, that's a big thing to look into there. What where did this come into your lives when we talk about hypogonadism and becoming the expert at 32 or an expert on this? You've been through your own story, right?
Yeah, so I've been educating in the field since 2019. I was talking about this back when it was a niche topic, and there was only one book written by my friend Jay Campbell. There was nothing on YouTube. No one really knew what it was. So I did a lot of health coaching for a number of years, just helping guys navigate this field. And then recently I've kind of moved into more educating and running and operating clinics and kind of working more behind the scenes with the medical providers. But my story was, I mean, I was probably lowish testosterone, just looking back at how I used to dress when I was younger. But in terms of when it really kind of came to a mess, was when I was 25. I had a traumatic brain injury. I was told that it wouldn't be possible for me to be able to function properly again. I had debilitating vertigo, so kind of like if you spun around on your chair 50 times. Fun when you're a kid, not fun when it goes on for 2 years straight. And that's what actually led me to science, was when everyone told me that I wouldn't be able to heal this. If it wasn't for initiating testosterone therapy before receiving that message, I probably would have believed it. But my response came more in the way of, you don't know how to fix it, but I will. So that's what took me back to university to learn about how testosterone was helping me both from a psychological aspect with rehabilitation, but also from a healing aspect biologically. So I really got into the trenches with understanding every aspect of the brain to heal my own brain. And then I wanted to be there for the men going through their same kind of dark hero's journey, because I went through it alone and it was very difficult. And I wanted to be able to help men all over the world have some hope, but also actually be able to get out of the mess that they're in and hopefully maybe even get to a better place than they were before it happened, which worked out for me.
So it's a great story to like know you're now able to help others as a result of it. And I truly believe Max and I had a conversation a couple of weeks ago, and we talked about our stories that we go through things and we can either be a victim to it or we can actually just use it to help others and to push people forward. And it's great that you're doing that. Max, what is your story?
Yeah, so I was a GP so I left general practice fully about 2 years ago to do mostly men's health and work around TRT. But my own sort of dive into this area was similar to Dave in the sense that I suffered from low testosterone. I had quite sort of more dramatic than a lot of people's risk factors for low testosterone. So I had a testicle removed at 29, so nearly 10 years ago. Then about a year and a half later, I had viral meningitis, which seemed to mess up my gonadotrophin, so the signal from my brain as well to my testicles. And so following that, I was in a really bad place for about 2 or 3 years. Low mood, anxiety, low energy, a lot of things. So when we were talking before, when Dave was talking about suicide, I mean, I wouldn't say I was suicidal, but I was kind of hopeful of not waking up in a sense because I felt so defeated. And it went on for about 2, 3 years before being, diagnosed as having low testosterone. Now, if I could go back in time now, obviously, knowing what I know, I would have been on treatment a lot sooner. I would have realized it was largely foundational due to low testosterone, and it could have made a huge difference to my life and my family. So for me, that inspired me when I realized that, holy moly, so many doctors in the UK know nothing about testosterone. And it's not just isolated to the UK. Obviously, it's quite a phenomenon in modern medicine. So that inspired my own change of career, my own journey into men's health, and particularly around testosterone. And exactly as Dave was saying, it's foundational. Now, there's a lot more to go into how you feel on a day-to-day basis, both physically and psychologically, but it can be a big problem if it's left untreated, if you do have rubbish levels. So mine was my own journey through it. And much like you were saying, turning a negative experience, which was pretty unpleasant, into a positive being able to help other guys out there with similar issues. I was quite on the far deep end of low testosterone symptoms, I would say. A lot of guys I see don't have my, severe anxiety, repetitive thought processes, all of that. But if you're somewhere in that spectrum, it can be pretty difficult. And it's good to be able to guide men out of it, whether that's with treatment or not, really.
Why do we think we're seeing more of these low testosterone symptoms, and what are those symptoms?
I tend to split it into three. I tend to say it's quite easy to sort of psychological, physical, sexual. So a lot of guys will complain of some degree of, your brain is not working as appropriately as well as it should do. I don't know about Dave, but I see a lot of brain fog when men have low testosterone, maybe some degree of low mood, apathy, lack of motivation, anxiety. Lack of stress resilience is quite a lot of the foundation of all of this. So people can't deal with the same sort of stresses as they used to be able to. And then physically, maybe fatigue, aches and pains. Maybe you get ill a little bit more often as well. There's a role with the immune system in inflammation with testosterone. And then people commonly will know about the sexual symptoms of low T, maybe some degree of erectile dysfunction, less erections, less strong erections, or lowered libido or lack of libido or less overnight morning erections, that sort of thing. But it can affect, that's probably not the exhaustive list, but those are the common ones you'll see. And why we're seeing more of it, I mean, I think it's environmental and lifestyle, really. I don't know if Dave wants to. Dave talks about a lot about, he's got his 3 Ps, which I like is a really good way of putting it as well.
I like things in threes and I like alliteration, so it ticks both my boxes. Pollutions, plastics, and pesticides, I think, are the environmental factors that, I was born in 92 and I was basically wrapped in plastic from a young age, fed the food pyramid that we're brought up on in Australia. And, I grew up in a very privileged household. I had fantastic parents, great socioeconomic environment, but because of how our parents were conditioned, from the 80s and the 90s, the way that we were brought up was to be afraid of the sun. Was, I think, our parents, particularly the baby boomers, often raised us to be happy rather than competent, which, they were doing their best. But I do think that there is that environmental aspect which is unavoidable. And I've traveled all over the world, and that's one of the privileges I've had in my career is, I'm primarily based in Australia. I've been living in Lithuania for 5 years. I get to speak at events all across the US, and I travel around Europe to see bands and see my friends. And I don't think we can put it all down to the environment, though, because people in Eastern Europe are doing a lot better than people in the US, for example. And we know that the food in the US is garbage, but there's also fantastic nutritional options available in the US. So I think that there is a degree of self-responsibility that people have to take. And I think a big factor that's overlooked is obesity during puberty. I think that's a big one. Like, that's one that, people don't really talk about who read mechanistic theory or spend their time learning about this stuff and, Reddit and YouTube. But when you're in the trenches and you see this stuff and you see it at scale, you can definitely see some trends play out. And I think poor health during the phase of the life when the endocrine system is developing sets you off for a pretty poor trajectory. And when we see this narrative that, men have optimal testosterone levels if they eat well and look after themselves well and they do everything right, that's definitely true in some cases. But I think that there is that combination of the behavioral factors and the lifestyle factors, as well as the environmental factors. And some people had a better start, some people didn't. There's epigenetic things going on there as well. Unhealthy parents have unhealthy children. I'm particularly concerned about the endocrine future of, obese parents who conceived while on SSRI antidepressants. Like, I think we're going to see this get a lot worse before it gets better. And I think that's one of the really important things that I do, Max does, people in my network do, is we're really trying to raise this awareness that when people are having health problems, number one is you do everything you can to optimize your natural testosterone production. And number two, if you're still feeling like rubbish, even though you're doing everything right, it's a much more plausible scientific fact that it is more likely to be an endocrine issue than the fact that you were born with a broken brain. The monoamine hypothesis of depression, that depression is caused by a brain that just can't produce serotonin, was debunked in the 1990s, but that's still common practice for mental health, psychiatry, frontline treatments for depression, everything. So I think one of the reasons that we're seeing more of it is that people's lifestyle is particularly poor, particularly post-COVID, the working from home era that we're in at the moment. People are a lot more indoors, they're a lot more sedentary, they're a lot more glued to their screens. And I think people often don't realize just how much work you have to put into in terms of offsetting that lifestyle to actually be metabolically and physically healthy. So I think it's coming from multiple angles. And I do think that for a lot of people, depending on where they've kind of picked up this journey of whatever phase in their life they're at, I think sometimes it can be a bit of an uphill battle. And I think sometimes, well, actually, I know all the time, we only get one life. We only get one shot at this. We only get one body. We get, X amount of laps around the sun. And I'm a big fan of men wanting to optimize their experience of life. And as long as all the other factors are in play and people have realistic expectations, I think optimizing bioidentical hormone levels is one of the most fantastic ways to build yourself into a man that can ultimately live a life that is satisfying, meaningful, enjoyable, purposeful, and hopefully can make a greater positive impact on the world around you.
It's a great answer with that. Max, have you got anything to add?
I would sort of double stamp the obesity during teenage years. I really think that that is something that's profoundly impacting. It's basically when your hormonal system gets set in place. So if you're disrupting that with inflammation, obesity, we know this disrupts your hormones quite drastically. It's likely, at least what we're seeing in practice, is a lot of men are never getting good levels of testosterone, even if they lose their weight after those teenage years. It's almost like men have been on anabolic steroids. It suppresses your own production, and sometimes your own production never recovers that great. But it's the same thing if during your development you've been essentially unhealthy, then that seems to have a lasting knock-on effect that perhaps we never get great levels, even if we start doing things well at a later date. And then you compound with that the fact that we do have these environmental issues as well. It's kind of like a bit of a perfect storm. But it's something you see in practice a lot. Kids into teenage years obese, it seems to really mess with their hormonal system.
I want to touch on that a bit more, actually. Sorry, Dave.
Yeah, I'm just going to add into that as well, just in terms of like a proof of concept, is that, this is a human issue as well. It's not just men, it's women. And as someone who's, 32, I can say that of all the women who I've met in my entire life within, let's say a 3 to 4 year age kind of, striking distance of myself, I know more women with debilitating period issues, endometriosis and or polycystic ovarian syndrome. I know more women who are having those problems than who don't. So that's kind of how this stuff is showing up in them. And it's absolutely something that I think is impacting the majority of young people. I think it's greater than 50%. And I would wager every dollar I have to my name that more than 50% of people who are around my age, give or take, have suboptimal hormone levels, whether it is to do with diet and lifestyle factors or I guess environmental and epigenetic issues as well.
How do we get this across to parents? Because I'm a new parent, thanks to your fertility protocols as well. They absolutely helped, and they do work a bit. Well, definitely work. How do we get this across to parents, though, who are getting kids and they're growing them up and they're just literally just spoon feeding them crap? I know some parents would just get defensive.
Yeah, I think as someone who doesn't have kids, I really do empathize with parents because you don't get an instruction manual. Everyone's kind of learning as they go. I had a lot more empathy and understanding from my parents when I got older to be like, wow, you had me at the age I'm at now, and you kind of had to figure it out as you went, plus everything else that you're doing with your own life and looking after yourself, etc. So it's I don't like people blaming their parents for their circumstances because, if people had a good upbringing, their parents did the best they can. You only know what you know when you know it. But one thing that, for example, living in Lithuania, seeing the diets that, for example, my wife's a couple of years younger than me, and her grandparents brought her up on, they'd slaughter a pig and drink the blood, and the parents would make a The grandparents would make like a dessert with like raw egg yolks, and there was the kids were still brought up on raw local milk, a lot of meat, a huge amount of butter, sour cream, locally ecologically grown, so like kind of like actual legit organic produce. When you go to the supermarkets here, we don't really have much in the aisles. It's mainly the perimeter of the supermarket. And the processed food is just something that people don't eat. People buy ingredients. Even when they're poor, they buy ingredients. So in Western countries, there's a lot more cultural programming to go against. And nutrition's a challenging thing because depending on who you listen to, depending on what your algorithm serves you on YouTube, you might be told that a carnivore diet, a ketogenic diet, a vegan diet, all these different things. I mean, now people are doing a sugar diet. Like there are so many different things that people are saying is healthy. And it can be, the more you know, the more you realize you don't know, and it can be very challenging. It's hugely confusing. I often tell people to go back to do what your grandparents told you to do because they got a lot of stuff right. Eat a banana and go sit in the sun if you're feeling sad. That'll help. But it's a real challenging thing. And I think the best thing that parents can do, particularly fathers, is you lead by example. As a particularly rebellious human and a far more rebellious child, I would not follow the advice of someone who I didn't respect and admire. So I think the best thing that parents can do is to lead by example, because children will mimic the behaviors of the parents. So leading by example is number one, but learning about how nutrition works, learning about how exercise works, and teaching and embodying that and building that into the lifestyle habits of the family for children to grow up and see as normal, I think is extremely important. The challenge is it takes a huge amount of work. It takes a huge amount of energy and effort. And, if the father's low testosterone and he's barely able to get through the day of work and all of these different challenges that parents have, I think it can be a really, 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 really big challenge. And I think that that's why, one, if people are wanting to have children, they should make sure that they can look after themselves before they want to look after someone else. But it is really a requirement now to take a proactive approach to health and nutrition, because if you simply follow what everyone else is doing or what the TV tells you to do, you'll end up like everyone else. And the majority of people in Western countries are overweight. A huge percentage are obese. I believe 30% are on psychiatric medications. It's a real mess if you do what everyone else is doing. And it's about that personal responsibility and agency to be like, how can I raise the most capable, self-responsible, and healthy humans that I can? And it's a proactive job that takes a lot of work.
It's a massive one. And the more I do this work in functional medicine and I see people's food diaries and stuff, and the more I speak with parents and they say their children don't eat vegetables and things, I see their food diaries and I just say, well, what do you expect? Because they're not eating the food. As you say, they are a sponge. Max, have you got anything to add to that?
Yeah, I mean, I've got 3 kids now. One of them was conceived on the fertility FSH and HCG protocol, so it worked like a treat within a couple of months.
Good marketing
But
there.
yeah, exactly. But yeah, 100%. I think two points that Dave and yourself have made is the responsibility, and it's quite difficult. My kids eat well, and it's not always a pleasant experience to make them a dinner, and then they start kicking off saying, "No, I don't want this. I want something else." Well, you have to kind of reiterate this idea that children don't know what's best for them. So you have to kind of, in a sense, be a little bit of a dictator when it comes to their nutritional choices. They can't just eat yellow food all the time, which is what most children would choose to have because it's not good for them. Setting an example, like, me and my wife, it's kind of like, well, this is what we eat. This is healthy stuff. This is why daddy exercises regularly. This is why he goes into the garage gym. All of these things. I mean, children are largely like trying to learn from you and mimic to a large extent. They kind of learn from you how to become an adult themselves. So that's how I look at it. I'm setting an example for them. So I eat well, my wife eats well, and what I prepare for them is kind of good food, because I know, especially doing this work, is actually this is setting up your hormones and your health for the long term. But I think part of the issue is people don't realize and appreciate how important nutrition is. I mean, you walk around the supermarket and, I'll be with be with the wife and kids shopping, and it's really quite demoralizing what you see people put in their food basket in the UK.
Yeah.
It's like multi packets of, crisps. It's like chocolate bars. It's all of these things, and you look at it, and then there's one bag of maybe carrots, and it's like, this isn't eating. This is just some sort of, it's like they've never developed adult taste buds or adult choice regulation as you've got older. And that's when Dave's talking about personal responsibility. That's so key to it. You can't expect to feel well and function well unless you're willing to commit to a good, healthy lifestyle. And that's on TRT or not. And the same applies to your kids in general. Kids can get away with a little bit more because they're so blooming active. They can have the lollipops and, run around and burn hundreds of calories in the street. Fortunately, I've got quite a good neighborhood because my streets are able to play out like the olden days. They're out when they get back from school, they're out in the sunshine, come rain or shine, they're out there playing like the olden days is how I described how I grew up. Whereas a lot of kids nowadays, inside on the screens, they're not exercising like we did when we were kids. So that's part of the issue beyond the nutrition. So anyway, I've gone off on one there because I like talking about kids side of things because it's a thing I've thought about a lot because I've got 3 now and they keep me up, but it's good. It's all good.
I like it. I see there's also, I know here in the UK, Dave, you could probably comment more on other countries, but it seems like there's a losing battle we're fighting against NHS and things like that, where when I had low testosterone, I'd go in and they would say, oh, you're just depressed, like stop feeling so stressed, and maybe not in those exact words, but you've been in the system, like first-hand experience, Max. What did you see that maybe you're not as frustrated with now because you're able to help people more with a bit more freedom, being a lead of a clinic? Like, what did you see that was holding doctors back from? Is it education? Is it time? Is it the system not letting them go down the TRT route? I went to the 12-week appointment for my daughter, like just to have like this check. And they tried to offer my wife HRT without any blood test just because she's 42 and just had a baby. There's like, it's just not the same thing, right? It's frustrating when we see things like that, but guys are being told, stop being stressed.
Yeah, I mean, me and my wife, funnily enough, were talking about this literally last night. So I think when it comes to testosterone, it's, without going down a conspiratorial route, there's definitely just a lack of education. So I was a GP, my wife's a GP, my dad's a GP, my uncle's a GP. I saw multiple GPs when I was ill. I saw a psychiatrist. I saw my nurse specialist who followed me up for my cancer. And no one suspected, including myself, testosterone. So we don't understand how fundamental hormones are. And that includes thyroid, that includes women's hormones, a little bit more knowledge about HRT, simply because generally speaking, if a woman is of a certain age, you suspect it might be the menopause. But if you removed that age for menopause, no one would have a bloody clue because we're just not educated how hormones impact everything in our bodies. But also there's a larger issue, I think, in medicine. I would say in the UK, can't really comment on other countries, is that we've become very guideline and protocol driven, which is you have X problem, here's Y outcome, and this is set in place. So if you come in with high blood pressure, we know which drug to give you. There's a little mention of lifestyle. It's kind of like a side point or an end note at the end. It's kind of like lifestyle is first thing, and it's like, and that's literally like a little line at the bottom saying do more exercise or something like that. And everything else is very prescriptive. And it's partly driven by fear of litigation. It's partly just the way you're taught. So we become a very fearful medical society as practitioners. So you don't want to get sued. You don't want to get in court. That's terrifying. So you stick to the guidelines. You stick to the rules. But also, you've lost that talent. Old GPs, you remember the old GPs you used to see who were kind of sat at the desk? They might have their feet up on the desk with like these weird boots on, and they were characters and they were just a bit weird. But they had their own thought processes. They knew the background physiology, the anatomy, the pharmacology, but they had no guideline to go off. But the problem is when you bring a guideline, and I know I'm going off piece a little bit here, is everybody learns the guideline. They don't learn what goes into the guideline. So why does this impact this? Why is this recommended here? And until you get your head out of the guideline and you actually learn about it, you can sometimes disagree with guidelines. because it's just someone who likes writing guidelines who's written them. And B, you can interpret science differently to someone else. Science is not like this set in stone picture that says this is definitely the answer. So that's what I think is going on with modern medicine. It's a bit of a ramble, but I do think there's a few layers to it. Testosterone in particular is a specific case, but in general, medicine has become a little bit too straight and narrow. This is what you do. This is the problem. This is the answer. And that's not really how human beings or bodies work.
Yeah, and also that actually goes across to things like in functional medicine, is that you still get functional medicine practitioners and doctors that literally just want to go down the protocol route, take these 20 supplements, and they get their commission for it. So is it just going through Western medicine? Is it going through a lot of medical areas as well? So
yeah.
Dave, have you seen anything different in other countries?
One of the things I love about living here is because we've got a lot left over from the Soviet Union. We were occupied here till 91. There's still a lot of practicing Soviet doctors, and everything, I mean, globally is becoming westernized due to globalization. But sometimes when you go here and you see someone who's more traditionally trained in even German medicine, Eastern European medicine, Russian medicine, their treatments and their approaches to the human body are much more based on biomedical science, which is my background. And so here, for example, when I recently had an injury, a dog attacked my dog, I attacked that dog, things didn't go well for my lower back. And when I went to see the doctor to, speak about, a short-term pain management protocol while I was doing rehabilitation, they wanted to really focus on reducing systemic inflammation, reducing damage to the nerve with things like IV infusions of alpha-lipoic acid. There was a much more holistic approach to understanding the body as a series of interconnected systems, rather than just opening your little handbook and saying, oh, for this, we give this. And I've always been appalled, and I don't mean to, throw shade at all doctors, because, I wasn't quite able to get into medical school when I left school. Doctors are very smart people. But I also don't think that any part of the Western medical training involves any degree of critical thinking. And I think it's contrary to that. I think they beat the critical thinking out of you. And it must be very challenging to be a general practitioner, because you have to be across so many different things. And I'm hyper specified in a very niche area. So if someone comes to me with generalized medical issues, I don't have a clue about these things. And one of the challenges of a general practitioner is that you have to deal with basically everything. And if you are a jack of all trades, you are intrinsically going to be a master of none, because it's just not possible to paint such a broad stroke and also have a degree of mastery or specificity over the areas that patients really need. But then this moves to like a specialist model where everyone becomes hyper specialized in a system that is interconnected to everything else that they don't understand. So it's a very broken model. And I think a lot of it is driven by the pharmaceutical industry. It doesn't surprise me that the little handbooks that doctors have will favor the medications that are on patent rather than the generics. And this is something that I think is doing a lot of patients a disservice. And when they speak to their doctors trying to understand the medication they're prescribed, it's not uncommon for the doctor to pull up Wikipedia, because they don't know a thing about what the pills actually do. So I think a lot of people go through this rude awakening where they realize that just because someone's got MD at the end of their name, or they wear a white lab coat, that they may not necessarily know everything about everything. But the problem is that if you throw the baby out with the bathwater and you go super contrarian with everything, you can also end up in a whole mess of things, because you don't know what to believe. The internet is full of charlatans and people selling all kinds of snake oil and nonsense with affiliate codes and yada, yada, yada. So it can be a very challenging and difficult process, because I think there are very few people in the health space who genuinely actually want to, one, further their learning, and two, actually help people as a primary goal rather than just making money. So it's a global challenge, but the UK is probably the worst I've seen, maybe on par with Canada. And it seems like the challenge in the UK is that, I mean, every country has rules. Testosterone is scheduled because it's performance enhancing, which is why it's scheduled in a harsher way than things like thyroid hormone or estrogen or progesterone, etc. So, there's rules everywhere, but it seems like the NHS kind of binds practitioners much more harshly by those rules than anywhere else. And I think that that makes it very difficult for doctors who even maybe want to veer outside the status quo of their little handbook, because if they do, then they're going to have fear of repercussion of losing their medical license or having a lawsuit. And, I'd be sitting there being like, well, it's probably not worth losing my medical degree over this. So I can really understand the catch-22 situation that GPs are in. And it makes sense to me why a lot of them become disenfranchised with the medical model, because they realize that they're not actually helping and healing people. They're just going through a revolving door of 15-minute appointments, and their patients aren't really getting any better. So my background in biomedical science is, really intrinsically understanding how the medications work, how the body works, and how these systems actually respond to these interventions. And that's furthered a lot of my work and education and research and teaching in the field, but it's definitely fighting a uphill battle, to say the least.
I would say as well, Max, how has it been dealing with clients when we look at NHS, where people are getting essentially funded like by the government, medical care, rather than self-funded when it comes to private clinics? Are you dealing with a different type of person who's ready to implement a bit more? Is that something which is shown its face?
Yeah. I mean, just to catch up on Dave's last point, that's my brain was rewiring over the last couple of years. It's very strange to go from being a GP every day and exactly like you were saying, that kind of 10-minute appointments, 10-minute appointments, bish, bash, bosh, same people come back, not really much change. It is quite demoralizing. That's why partly what pushed me out of the door in the end was I just felt like it's almost like acting, to be honest. You're having to portray a role and, almost act as if you believe in a lot of what you're doing, whereas actually in reality, you see the results is not really making that drastic of changes. There's always, there's standout cases where people do have a massive response to something, but commonly a lot of it was just same issues coming back through the door, and it was just quite demoralizing. So that was just an interesting point. I thought from my own experience, definitely that's how I felt when I left general practice. But what was the question? I just got sidetracked.
It's clients that are more ready to implement when you're in the private clinic, rather than, I've got NHS service, I can just go and use it and not have to make any changes. And as we said about taking responsibility ourselves as well.
Yeah, I think there's kind of there's a couple of different categories that I see, but definitely there is a self-selecting element to it, where some of the guys I talk to, when we get on the phone, we'll end up talking about, halfway through the consult, we'll end up talking about conspiracy theories and, red pilling and all of this sort of stuff, because they tend to be, not all of my guys, but a lot of the guys have been guys who have done a lot of self-researching, and then they've lost trust in, like you say, their GP, maybe they've been told their, for example, testosterone is normal, whereas when they've done their own research, they realize it isn't. That's sent them down a rabbit hole. So a lot of them are self-selecting for more, I think that word that Dave's, the term critical thinking, potentially, but also a bit more dedicated, because part of there's an issue with the private sector compared to the NHS. Obviously, you're paying for it directly rather than through a taxation system. But that also inspires them to hopefully and more commonly be dedicated to get the best out of the treatment, because they're shelling out for it directly. So that means they tend to be a bit more committed than the average patient I was seeing in general practice. So if you tell them to exercise more, if you tell them to do X, Y, or Z, if you get them on a training program with our strength and conditioning coach, the uptake and the commitment is more often, pretty decent, rather than in the NHS, when you tell someone to exercise regularly, if you tell them to do this and this, A, you don't have the time to really specify what you mean, but B, the uptake on that is kind of not so high, I would say. So there is a bit of self-selection going on. A lot of people come to me because they're disillusioned with being told repeatedly everything's fine. And that's the same case with thyroid. That's the same case with testosterone. I deal with a little bit of women's stuff as well. Similar case there. People are told things are normal. They show me their blood work, and it's like, well, actually, it's in the normal range, but it's not necessarily normal for you. So yeah, a little bit of all sorts, really. You occasionally get the guy who really has done no research and just seen an advert online, and then he comes through to it and then you have to give them the whole sort of information, the whole background to even testosterone in much greater detail than other guys have already done a lot of research. They're already red pilled on a lot of the system and things like that, let's say. And, you know, they're in a different boat. Yeah.
What are the common things that people are seeing on tests that, I mean, that I think I first heard of you, Dave, in the TRT Facebook group that Facebook wasn't too comfortable with and decided to shut down. It's like 17,000 people, I think, in there. And it was always the thing when people were coming talking about hemoglobin, hematocrit, and needing blood draws. What are the things that are very commonly thought of and needed on TRT, like blood draws and stuff, that potentially aren't necessary?
Yeah, there's a lot of them, and I mean that's probably a whole podcast in and of itself. So
Yeah,
the red blood cell count is a big one. There's a lot of confusion and misunderstanding of the difference between polycythemia and secondary erythrocytosis. You know, the former being a blood disease, the second being blood being too thick because of something else. And typically, blood being too thick because of something else is because if you tell a patient to get a blood draw fasted first thing in the morning and you don't specify that they have to also hydrate with a liter of water, they'll typically come in, or you say hydrate before the blood test, they might have 125 ml of tap water before they go in. So doctors and general practitioners will see an elevated hematocrit above the reference range, which I've seen the UK reference range only go up to 50. I mean, sometimes it only has one decimal place. So, you know, if everyone with a hematocrit above 50 is going to die, everyone's screwed. On TRT, off TRT, I mean, it will only be the endurance athletes that will survive. But it's the main problem that we see with that is more so that, you know, testosterone will add a therapeutic couple of points to hematocrit. And I use hematocrit as the proxy for hemoglobin as well. But testosterone will add, as part of the therapeutic mechanism of action of increasing oxygen delivery to the cell, it will add a couple of points to hematocrit, which is not a problem. It's a problem, though, if that number is already high due to secondary erythrocytosis from sleep apnea, lack of cardiovascular exercise, smoking, alcohol, obesity. So in situations like that, you know, testosterone can potentially be the straw that breaks the camel's back. You know, if someone comes in morbidly obese and alcoholic, insulin resistant, and they take the testosterone levels of a healthy 21-year-old, you can't without some degree of entitlement mentality expect that to go well. I mean, that just goes against common sense.
Yeah.
But practitioners are not taught to factor in the actual just general healthiness of a patient when it comes to treatment of hypogonadism. And, you know, this is one of the main causes of side effects. So that's often a problem because then the doctor will say, oh, you need to go get phlebotomized every 12 weeks, and the patient will become anemic and depleted of nutrients. And it's just it's a huge mess that just comes down to incompetence at core. The other ones that we see is, you know, inhibition of estradiol. And I understand where men come from with this because they think testosterone makes me a man, estrogen makes me feel like a girl. I don't feel like enough of a man. So if I block the girl part, then I'm going to be more masculine. Like I understand the thought process. It's wrong, but I can see from a layman's perspective how that would come through. Because a lot of the time when guys are going on TRT, at core, regardless of what vernacular or how they describe it, they want to feel more like a man. They want to feel more masculine, whatever that means to them. So I understand that when they go on TRT and they see their serum levels have peaked after 8 weeks and they're saying, well, I don't feel like a superhero, I don't feel like a super confident, alpha, aggressive male, then I understand why they're going, okay, I must need some kind of other medical intervention because this is how we've been conditioned. Something wrong, take a pill. But a lot of the problems that we're having on TRT are coming from poor protocols, which are unfortunately dictated by a lot of these guidelines that, you know, you guys in the US have through the NHS, and other countries have all these poor guidelines as well. And a lot of the time it's problems with a poor protocol or it's a problem with the diet and lifestyle. And a expert, competent practitioner should be able to optimize a male's bioidentical testosterone levels without the need for pharmaceutical intervention inhibiting an essential enzyme in the body. But unfortunately, people just don't know what they're doing. And again, it comes down to a lack of competence. So that's probably the big ones. The other big concern is that for some reason, just based on, I mean, I know why it is. It's just because the stuff that people read on the internet that's wrong. is that, men are thinking that testosterone is a form of contraception. If it was, it would be so popular as a male birth control. Like it would be the bee's knees. But unfortunately, it seems like if you want to keep your fertility, you'll lose it. And if you want to become infertile, you'll keep your fertility and accidentally become a father. It seems to just go that way. But TRT will absolutely complicate fertility for sure. Some men will need a fertility protocol, but half of them don't. And the other half that do need the fertility protocol, that fertility can be recovered. So there are a lot of these misconceptions that people have because either their doctor tells them the wrong thing, or the person with the most content visibility is just the person who's the best at digital marketing. It's not the person who's the most knowledgeable. But when people have social proof and they're getting bamboozled by big words and they're fearful and they don't know what they're doing, it's very easy to be sold on a clinic selling you a fries and a Coke with your testosterone. They're selling you the estrogen blocker and the HCG, and men are ending up sometimes worse off than before they started. So just like you wouldn't get brain surgery from the cheapest surgeon you can find on Google, people shouldn't do testosterone replacement therapy with the cheapest, most budget, incompetent provider. This is interventional endocrinology is serious stuff, and it has a huge risk to reward ratio. When it's done right, it's the best thing in the world. I mean, I dedicated my entire life and career to it. But when it's done badly, it can cause more problems than it solves. And, that's why the UK is, probably not doing very well with this, because outside of Max, there's not a whole lot of people in that country that know what they're doing.
Yeah, it's worrying. And I think as well, we've got blood tests. Are there any other tests that you guys look at regularly when it comes to hormones or just general health that people can look at and think, actually, it may not be testosterone, it could be this other thing that's going on?
Yeah, I mean, Dave talks about it a lot. Thyroid, seeing a hell of a lot of thyroid nowadays. Big issues with thyroid all over the place. Men and women becoming more common. Probably similar sort of profile as to why as, testosterone and things there as well. But yeah, you'd say thyroid issues can look and sound very much like a testosterone problem, and they obviously have a knock-on effect on your testosterone levels as a bloke. Poor metabolic health is a big deal. Obviously alongside those lifestyle changes we were talking about and those lifestyle issues that we've got, you've got a lot more insulin resistance, you've got a lot more poor metabolic health, fatty liver disease, all of these things that can have a knock-on effect on your hormones, but also how you feel. And a lot of things can sound and look like a low testosterone problem. That's why when you get assessed for it, you've got to get the whole sort of panel looked at rather than, I was quite shocked when I started doing this work that I'd actually seen men transferring to me from other clinics who had just had their testosterone checked and they'd been put
Just
on
their
TRT
testosterone?
and just their total testosterone, in fact. Wow. Yeah. And they were transferred over to me, and I kind of said, so why did you have low testosterone? Oh, I don't know, just got my testosterone checked and it was low, and they'd started on treatment. Now, I thought the UK was quite regulated and things, but apparently there's still a little bit of dodgy dealing going on. But yeah, so you've got to get a full panel done if you want to be assessed for testosterone, because it can be lots of other problems. Plus, you want to know how your health is, because like we were saying before, TRT is not always the answer. If you've got a poor level of testosterone, that doesn't automatically mean you need TRT. There might be some other things that need looking at, including lifestyle, thyroid, that need correcting, and you can maybe delay or avoid TRT altogether, which would be a great outcome. If you don't need it, great, don't take it. I mean, it's the lifelong commitment to injecting yourself or rubbing a cream on your balls every day. So it'd be quite great if you didn't need to do it,
Yeah, absolutely. Absolutely. Dave, are there any tests that you look at regularly?
I'm a big test not guess guy, because one of the things that I used to do about 40 hours of health coaching calls a week with clients for many years, and I do significantly less than that because I work now a lot more behind the scenes with the clinics. But the most important thing that patients can do is get comprehensive blood work done. Mm-hmm. And comprehensive blood work is not free. In some countries it's a lot more expensive, in some countries it's cheaper. But you also have to have a practitioner who can actually make sense of not just the individual biomarkers, but the patterns in between. So if we're looking at blood tests in isolation, it's not particularly useful. If you're a mechanic and you pop the bonnet on the car to look at the engine, You have to look at how all the parts are working together. And looking at one specific part, saying, you know, well, the problem in the noise is coming from over here, but it could be coming from, like, the root cause could be over here. So I really insist when I'm working with guys on getting comprehensive lab work done, because comprehensive lab work not only allows us to determine if there is a resolvable cause of the low testosterone, which, as Max said, if you can get the benefits of TRT without going on TRT, that's the best possible thing. But the part that's important is that all the stuff that you have to do to optimize that natural testosterone production, if you want to inject those testosterone levels exogenously, you have to do that stuff. It's like, if you remove the rate limiting pathway for testosterone production, you have to work with the body, not against it. So if we have someone who's got, let's say, secondary hypogonadism, which is when the testicles are working just fine, but the signal is suppressed from the brain, if that signal is suppressed due to poor diet and lifestyle, and the body's pumping the brakes on this hormone production, and you come in as the genius you are and go, I'm going to pump the accelerator at the same time, you're not going to have a smooth ride forward. That's just not how the body works. The body's smart. We don't really fully understand the human body yet. That's one of the cool things about science. We're still learning. So I really like the patterns in the blood work, and that's a lot of what I teach providers is how to actually understand the full picture of the patient's health, and then how that's going to apply to the therapeutic outcomes. So, you know, if we have a guy, for example, with elevated HbA1c, elevated liver enzymes, elevated bilirubin, elevated GGT, elevated triglycerides, elevated red blood cell count, and suppressed testosterone at baseline, we can look at that and go, you have metabolic syndrome. And if this is something that is as a result of poor diet and lifestyle habits, if they're firstly, we want to see if we can correct those and restore natural testosterone production. But if the patient has already elected to start treatment elsewhere, a lot of the time, as Max says, you inherit people who've already pulled the trigger on this. But if the patient elects to go ahead with treatment anyway, if those other health issues are not resolved, they're going to cause side effects. And this is the main problem that we see in these forums, and I get in my inbox all day on Instagram, and you know, we see it all the time. And once you understand it, you can't unsee it. And basically, the problem is that the distance between the level of testosterone you're taking and the level of testosterone your body should have is side effect territory. So the patients have to put the work in to close that gap, but sometimes there are additional testings that need to be done. You know, and as Max says, it's very prominent in the UK. It was one of the first things I learned is things like subclinical hypothyroidism, low-grade Hashimoto's thyroiditis. Another one that I see a lot is fatty liver disease as well. These issues that are causing problems with the energy metabolism, if you come in and basically upgrade the engine in the car, if you upgrade that to a Ferrari engine and the rest of it's a Suzuki Swift, you're going to run into problems. But the issue is that patients are not being properly educated, they're not being properly tested, they're not being properly diagnosed and treated. And these are the things that I see all the time. People come to me for private consulting when they're typically at the end of the line. They've seen everyone else. No one else can work out what's going on. No one else knows what it is. And I look at their lab testing. I'm like, no one's investigated any of this stuff. And sometimes there are pretty blaring things in the blood work, but because they're within the reference range, they're going, oh, well, it mustn't be the problem. So comprehensive blood testing is really important. I don't do anything with the dried urine testing. I don't do anything with saliva testing. I think that the saliva testing can carry merit with some stuff. I don't think the dried urine testing does with hormone replacement therapy. And but comprehensive blood serum testing and a full assessment of the patient's diet, lifestyle, medical history, everything that's going on with them as a person is super important, because if we find things that are going on, and a lot of the time, you know, when you're talking to someone for 45 minutes to an hour, once you've built rapport, they'll drop the bombshell at the end just in conversation, being like, oh, you know, my wife says I snore like a freight train, and it's going up. You know, we've got some undiagnosed, unresolved sleep apnea here. That's going to cause some blood pressure problems if we do TRT. You know, there are so many things that patients don't realize need to be investigated or could be problematic. So it's also very important for the provider to actually understand this stuff, to have enough experience to see around the corner, probe and ask the right questions to make sure that they can set the patient up to have realistic expectations, to understand the work that they need to do to work with the medicine, to meet the medicine halfway, and then to understand how to properly follow up and investigate things. And TRT is probably more work than people think it is. It's not a shortcut. It's a great power, great responsibility thing. You know, if people think this is a shortcut, you're going to have a really rude awakening that you're just basically committing to living as a healthy, high testosterone male would be if you were making those levels naturally. And that can be a rude wake-up call for some guys. But if people want to drop the entitlement mentality and take some agency and responsibility for their lives, then you got to put the work in. You got to invest in yourself, both in terms of financially in your treatment, but also in the work that you do. And if you want the incredible, amazing outcomes that a lot of guys want, there's work that goes into that. And part of that work is proper blood testing and proper diagnosis.
I love that you just say it straight up. I think that jumped out on one of the posts I saw when we were talking about fertility, and you were talking about FSH and HCG and things. It's going to cost some money, but if you're worried about the cost of that, then like you probably shouldn't be having kids in the first place.
Yep.
So true. So you've got the TRT Academy. Is that where are you teaching things like this? Is information like what we've spoken about today?
Yeah, I'm very big on social responsibility. And with understanding how the economy is these days, I wanted to be able to provide a low ticket community that exceeds value. You know, it well exceeds the price tag of the community. I used to have a Facebook group, but the Facebook, like, it's ridiculous to pay for a Facebook group and then the posts don't reach anyone. You know, you've got 1,000 people in a Facebook group and your post gets delivered to like 80 people. It's just, it didn't work. So I moved it across to school. I spent a long time kind of working out what the best platform would be because Facebook's easy and, you know, Discord's too hard for a lot of people. So I found this kind of happy medium in between. And I'm very proud of that community because I contribute to that community a ridiculous amount, and I want to be able to provide people what I think they need. So I do Q&As twice a week where people can submit questions in advance and watch them back later. I've just started doing group calls as well so that providers and practitioners or enthusiasts can just shadow and sit in the background and see the process for guys who are willing to, you know, share what's going on with them. So that way people can learn and get help and get personalized access to, you know, actually having a conversation at a low ticket cost, but also to just give guys an archive of all my best video work, written work, every piece of value I could possibly provide at, you know, less than $1 a day. And I'm really passionate about building a community of like-minded people who are here to contribute and help and to further their knowledge. So yeah, that academy is something that I do 2 Q&As a week in. I do 2 group calls a month. I post either like a private video or a big written post most days of the week. And I'm very big on I don't spoon feed people. I give them the resources, I give them the education, I give them the information as it is so that they can understand it. You know, I speak in a way that people can actually not feel bamboozled by big words that they don't know. And ultimately get them to a point where they can get from A to B in however they need to do that. So yeah, the TRT Academy is something I'm very passionate about. I've also got a few ebooks that have all my intellectual property. They are designed and formatted like the video game manuals I had when I grew up so that everyone can kind of have the instruction guide that should come with TRT. They're super affordable. They're 29 Australian dollars. If anyone can't afford it listening to this, send me an email. I'll send them to you for free. And I really want people to be able to have all the information that they need. And then if people need more personalized help, I have a clinic in Europe, so we service all of Eastern Europe, the Baltics. We're moving into Scandinavia soon. I have a clinic in Australia, Primal Zone. I have a partner clinic in the US, Victory Men's Health. And then anyone in the UK who needs treatment, you go to Max.
Yeah. Max, do you want to follow on from that? How people can get in touch with you? Well, it's through the clinic, right?
Yeah, it's through the clinic, alphagenics.co.uk. Yeah, so that way you get emails. There's an email or there's a phone number to ring. People can follow me on Instagram and things like that. But I will say that Dave's books, the ebooks, and the School Academy are great. So I'm a member of the School Academy. He posts a lot. There's a lot of useful information on there. And
I'm about to sign up to it as well. So
yeah, the ebooks are somewhere in. I print everything off because I hate looking at the screen. But yeah, they're somewhere in this room, so I'll often refer to them for patients and things like that. But yeah, for key for listeners is exactly what Dave talks about all the time, which is, and you see it in my day-to-day practice. It's if you're going on testosterone, if you're on it, you've got to live as if you're making those levels yourself. That's what's so key because that gap in what you're doing and what your hormone levels are at, that's where you don't get good results, basically.
Yeah. And you can make it worse.
Yeah.
So, guys, I really appreciate. I can't speak. I really appreciate you guys giving the time. That's the words. I really appreciate you guys taking the time to come on the podcast, the Optimal Health Podcast. Are there any other things that you think that we should have covered that we haven't covered that you would want to just get out there? Are we good?
Not everyone on TRT needs HCG. I'll say that because that's a common one in the UK. Yeah.
Cool.
The point that I'll kind of, I guess we've kind of brought it up a lot, and I don't want to blow too much smoke up Max's ass, but I will blow a little bit up there. Is the eyebrows raised? It's very confronting when you realize that your doctor doesn't know what they're doing, but it doesn't mean that you know what you're doing either. You don't go out and buy, like, every surgeon uses the same scalpels. It doesn't mean that you can go buy a vial of testosterone, watch a YouTube video, and do your treatment yourself. You wouldn't perform open heart surgery on yourself just because you're not confident in your surgeon. I see so many messes in Facebook groups and communities, or guys who come to see me once they've kind of hit the dead end and worked it out. You can't do this without expert guidance. If the average doctor who did God knows how many years of medical school doesn't know how to do this, the average TRT patient doesn't know how to do it either. And that ultimately necessitates expert practitioner guidance. Every problem can be prevented or solved by someone who knows what they're doing. The problem is that I don't exaggerate this number. I wouldn't have believed this number is so high until I went to the UK, not the UK. I did recently go to the UK, but I didn't see the mess of the TRT clinics there. Went to the US, went to the Olympia, ran a bunch of seminars, went all over the US speaking at events. I didn't realize how bad the status quo is. If you just walk into the average TRT clinic and think you're going to get an expert level of care, you are going to find out the hard way that the average TRT clinic is just there to make $1. They don't know what they're doing either. So save yourself the pain, the hassle, the disappointment, the biological implications of having this go haywire. And if you want to do this and you want to get the best possible results, which everyone does, from day one, you go to the best provider in your country that's available to you. And if you're listening to this in the UK, you just go to Max at Alphagenics. I don't get any kickbacks. You go to Max. Because the cost of not doing so, you'll end up paying back not only financially, but also in pain and suffering, and the opportunity cost of not feeling the way that you should feel. So if you're outside of the UK, I've got clinics all over the world that I only partner with because I've either trained the doctors, I work with the doctors, or I do the protocols myself. But if you're in the UK and you're listening to this and you're interested in TRT, it may be tempting just to buy a vial online and start your treatment yourself because you watched a few YouTube videos. And if you're lucky and everything's simple with your case, that might turn out okay for some people. But you will only find out about the problems when they occur. And it's so much easier in all fields of medicine. Prevention is cheaper and easier than fixing things, and rehabilitation. Prehab's easier than rehab. So go to an expert provider if you want the best possible results. And in the UK, you go and see Max.
I would also add to the fact that if a clinic isn't telling you to get bloods regularly, then something's probably going on. Like, when people are doing this on their own, they'll make an excuse. I feel good, I won't get the bloods done. Still do the bloods, right? So,
absolutely.
Guys, thank you for joining me.
Thank you for having me.
Thank you.